Hello, my name's Anthony Broderick, and I'm with Tina Murphy, who's a service manager in the mental health sector. And we're based in Derby, and it's the 9th of September 2009. And I'm going to ask Tina a few questions about her job. So, Tina, before we talk about your job, can you tell me, where did you go to school, and did you enjoy your time there?
I went to school in Alstree, and I didn't like school very much.
Did you not?
It was okay. It was alright. I didn't love it.
And what did you do after school then?
Went straight into nursing.
And did you get good qualifications at school then?
Yeah, well, enough qualifications to do nursing.
Yeah. And so you went into the city hospital, was it? Or
no, Kingsway.
Kingsway.
Yeah.
And so this leads on to the next question, which is, what have you done since leaving school to now?
I've been a nurse ever since I left school. Since the day I left school, I've been nursing.
And has nursing changed much?
Well, mental health nursing has, yeah.
Is it?
Yeah, it's very different. Yeah, very much more modern.
And is it better now than it was? Or?
I think some things come full circle. Some things we were doing 30 years ago, and
you're doing them again now.
And we're doing them again now. Yeah, but generally, yeah, it's definitely improved. Yeah.
Okay, great. So, can you tell us what you do now then?
I'm a service manager of a community mental health team, which means that there are about 25 of us working in the team. I'm their manager basically, so I make sure the service runs as efficiently as possible, that they get support to do that I manage the finances for the whole building for them, and I provide supervision for them clinically and managerially. And I just make sure that any developments that need to happen, I get them from them.
And do you have to look after 25 staff? Do they all come to you for the
Well, it's actually 30 because I've got two bases.
Right.
One in Swadlincote and one in Wirksworth, so there's about 30 of us all together, yeah.
Oh, they're pretty spread out, aren't they?
Oh, yes.
And so all those 30 people come to you with their
Well, no, I've got deputy who supports me. But yeah, I'm basically it, yeah.
And what inspired you to become a mental nurse then?
My careers teacher, careers person at the school, suggested I go to the hospital and have a look because they might be interested in it, so I did.
Yeah.
And I just met a couple of patients and just fell in love with the place, and that's it.
Yeah, that's great.
Yeah.
And so, what are the best bits of your job and what are the worst bits of your job?
I hope nobody in the NHS uses it. Best bits. I like bossing people around. So it's really good to have half the time being a manager. I love that. I would not want to do that.
Yeah.
But I also like seeing patients because in my job I can still see patients.
Yeah.
And I love them.
You like being in charge?
But I love being, because it gives me the opportunity to, if I want something developing, then because of my role I can influence.
Yeah. And what are the worst parts of your job then?
The money.
Money.
Nursing is very poorly paid.
Yes.
And had I thought about that before, I may have chosen a different career.
Yes.
But I do, my wage is significantly better than a lot of nurses because of the position I'm in.
Yeah.
But for a woman of my age, it's significantly low compared to a lot of other people as well.
Yeah, fair enough.
So it is a disadvantage, yeah.
And what does a typical day consist of?
Starts with emails and phone calls. Maybe supervising staff, maybe going to meetings, maybe seeing patients. It's a real mixture.
Every day is different.
So every day is different. It may be driving from base to base.
Right.
It involves perhaps driving back into the city, which is where my management is, because that's based in Derby City, even though I work in the county.
And are there any specific challenges and satisfactions of your job that really get to you?
That I like?
Yeah, the satisfactions that you like, yes. And then the challenges that you hate.
Well, it's seeing, I suppose, the things that really satisfy me, the things where we can see patients achieving success. So you can either see people recovering, people don't want to harm themselves anymore, say, or people who haven't been out for years are now going out. And, I actually saw somebody today who was really scared of going out. And she was in a position where she got to go meet somebody and they hadn't arrived. So she said, right, I'm going to brave it. And it was lovely. I watched her out the window and I was like, yes, fantastic, she's gone and done that because we've sort of said, you know, you can do it, whatever, and we've worked with her, and she actually just had to do it and was prepared to give it a go, which was really, may sound nothing to other people.
No,
but it's a real satisfaction.
So that's what it's all about, isn't it? It's to kind of get people back on the feet again.
Yeah, and then from a managerial point of view, if I go and do performance reviews, and we get a good, we've got a good rating on certain things that we're doing, then that shows me that because I think my team's brilliant.
Yeah.
Obviously, most service managers think their team's brilliant, but it's really good when I can see that my team are achieving what they should do. Yeah, which is really good, and then it means I can go back and say, you know, this is what you're doing really well. And, we're all doing a really good job.
And do you have specific challenges in your job then that you don't like? Yeah.
Well, the paperwork's always a challenge in the NHS because you always have to do things which is increasing, which in some respects is helpful. There's no denying that, you know, there are some elements of the paperwork which are really good, but sometimes I think, you know, most of us think that we spend too much time.
Yeah. Okay. Now, if I was a student and I wanted to become a mental health nurse, what advice would you give me to kind of get into that field?
Not sure. I'd say think about it very carefully, but also not be put off by what you hear in the media. That's a concern to me. That mental health gets a bad press still. You know, something happens in the community and it's attributed to somebody who's got mental illness and it puts people off. And I would say don't let it put you off. Yeah. You know, go and talk to people, find out about the local NHS services, go and find out about.
And you'd recommend this job to others, would you?
I would, yeah. It's a real. Apart from the money, the job's fantastic. Yeah, it is really fantastic. Yeah.
Now, if you were 13 years old again now, and you could start your whole secondary education again, would you change anything from the first time round?
I'd go to university.
Yeah.
Which it's not. I didn't get because when I did my training, you didn't have to go to university to do it, and I would, give myself different opportunities.
But you work harder at school, didn't you?
No, I'd work differently. I did work hard. I was a bit of a sport, but I'd work harder. I don't think I understood really what university was all about and what the other opportunities would have been. Because right from an early age, I just wanted to be a nurse, and I didn't really consider other options.
Yeah.
I thought about them, but I didn't really. I would say to anybody, just unless you're absolutely dedicated to one specific thing, which I was, but I do regret it.
You didn't explore others?
No, I didn't. I didn't explore enough, and I'm not saying I wouldn't have chosen nursing because I love it, but I may have I think.
Okay, great. And now that you've had years of knowledge and wisdom, what advice would you give to a student leaving college today? It's not about your job, it's just about the world in general, and life. Have you got any words of wisdom that you'd pass on to them?
I would say, don't start work straight away.
Don't.
Go and see some places.
Travel.
Do some other things, because I was going to go and travel after I did my training, and then a job came up, and I went for that job, and it stopped me doing things with my sector with that children.
It's very hard to go back.
And you can't go back, it's hard to go back, and especially because nursing is quite a vocational sort of career in a way. You don't have the money.
Yes.
To do what you're really allowed to do, but I would say do a bit of travelling first, do that typical sort of years out, and then get into it if you can, if you're able to.
Yeah, just to explore a bit of the world.
So you can explore a bit of the world, make sure you make the right decision about what you're going to do.
Okay, well, Tina, thank you very much for that. That's been really interesting.
It's a pleasure.
It's been great. Thank you.
Thank you.